Hello and welcome back to KXAN Plus. I'm your host, Esmeralda Zamora, and today we have our Simple Health segment. Of course, we have our Simple Health segment here on KXAN Plus. Remember, if you are watching on social media, our website, or even our app, we are also available on your app store on any TV streaming device you have. Roku, Fire TV, Apple TV, and Samsung TV. Now let's get into it with our Simple Health expert, Jose Torres. Jose, thank you for joining me. How are you doing?
I'm doing great, Esme. Thank you again for having me.
Of course, always here to talk about Simple Health. But before we get into all the fun stuff, tell us a little bit about what Simple Health is and why we cover Simple Health here on KXAN.
Well, here at KXAN, we try to make everything easy and digestible for you because, medical research that you come across can be hard to understand sometimes, or if maybe knowing the treatments or what causes a certain disease might be overwhelming to get all that information in. So what we try to do is make that easy for you to digest. And we're doing that today with a topic about National Blood Cancer Awareness Month. And as we're going to learn so much about this, and hopefully this will give hope to people who are either battling blood cancer or know someone who is.
Yeah, Jose. And like you mentioned, Simple Health is a way for us to kind of break things down, make them easier to understand. And to help us do that today, specifically on this topic, we have two very special guests. Tell us who our guests are.
Yes, we have Kathy Miller here with us. She is a blood cancer survivor. And we also have Dr. Arvind Ramakrishnan. I hope I said that correctly. Well, let's get started with Kathy. Kathy, you have an incredible story to share with us. And it all started with some fatigue. Is that correct?
Severe fatigue, severe exhaustion, bruising, inability to do basic things like walk to my car. Those were the biggest signs.
And so you're a hairstylist, and you were talking to one of your clients, and that led you to the doctor here who helped you kind of diagnose and let you know a little bit more about what was going on.
Yes, I have actually, there's several clients of mine that are physicians, and they all kind of noticed I didn't have any pep in my step. And so one of them was finally like, let's do some blood work, figure out what's going on. And then I didn't go. And then the next physician client I have came in, and she was like, you're bruising and you're off. What is happening? And I told her I wasn't feeling well. And she was like, let me order you some blood work. Well, somebody already did, and I haven't gone. She was like, Kathy Miller, you need to go get your blood work. So I did. And then within 24 hours of that, I found out that I was very ill with leukemia.
And Doctor, do you want to explain that process when you first met Kathy and kind of sharing that news with her?
Yeah, it's always a shock for the patients to hear. But Kathy had a very, very high white blood cell count. It was almost 300,000. We were all shocked that she was still working and looked pretty good, remarkably. Most people with that white counter can't get out of bed and they can't breathe. But obviously, it's still a shock. But one of the things I wanted to make sure Kathy knew about was that, she was at the right place to get treatment, and that, treatment wasn't going to be easy, but we had a solution for her, and that our aim was to cure her of this disease and get her back to life.
And this happened at the treatment that you're talking about at St. David's South Austin Medical Center, which I had no idea specializes in this kind of treatment. Is that right?
That's right. We started a transplant center at St. David's about 10 years ago in 2014, I guess now 11 years. It's called the Sarah Cannon Transplant and Cell Therapy Program, and it's a collaboration between St. David's Healthcare and Texas Oncology and Sarah Cannon. And we mostly treat patients with blood cancers, and we provide them access to cell therapies like bone marrow transplants, CAR T cell therapies, and other clinical trials for aggressive blood disorders.
And Kathy, you were telling me that during this process or right before you were diagnosed, you were working 7 days a week, I believe, and you were still going at it.
Yes, powering through. I work in the film industry, and I work with private clientele at a salon here in Austin called Mint, and I just was doing what I always do and figured it was either long COVID or a cold or something I had caught from a client or on set. So as we do, sometimes we ignore the signs until it gets unbearable. And I think I'm really fortunate that the people in my life forced me to do it. Otherwise, I don't know that I would be sitting here today.
Walk us through these photos here that you are sharing here with us.
This is of my port. I was really sad to have that put in. This was when I first got diagnosed and I still had hair, and I was really optimistic and happy. And then, love, you can't have flowers, you can't have anything alive around you. So people sent flowers. And I was bald, and very ill, and very weak. And yeah, I think I was throwing up in the bathroom when that was taken. And this is Dr. Rama, the day that I was getting my Rama Krishnan, the day I was getting my transplant.
And explain to me, like, what went through your mind when you were given the diagnosis and then you were told about the news about the treatment? What went through your mind during those times?
Fortunately, someone I love and also in the medical field told me I had it. So I panicked and started crying and continuously asked if I was going to die. Am I going to die? Am I going to die? And she calmed me down and she said, "You're not going to die." So after that, I was confident because I trusted her. And then from there, where do I go? What do I do? So fortunately, I was able to get into Rama Krishnan's floor very quickly. Within probably 2 hours, I was at the hospital.
And Dr. Ramakrishnan, you said as technology develops, the cure rates are going up.
That's right. It's a remarkable time in medicine. We have a lot of advances in technology. And my hope is one day we can go away from some of our current treatments and make it easier for patients where when you get a diagnosis like this, we can just give you a shot and everything goes away. It's not that straightforward right now, but we are working towards that. And some of the ways we do that is through research and clinical trials, bringing new treatments to patients so that they have access. We have a lot of patients in very difficult situations, have very resistant cancers, and we want to make sure they have options. And the other thing that's really important to us is make sure we're caring for them like they're part of our families. And that's what I think Kathy is. She's part of our family ever since we met. And we get to hear about everything that happens in their lives and get them back to the world, and that's what keeps us all going.
You're very passionate about this, doctor. Why is that?
Well, I had great teachers that taught me this stuff. And the other thing is our patients really, they motivate me to kind of do better and keep learning and keep trying to innovate here in town. We have a great group of physicians here in Austin, and we all work very well together, and we're all focused on the patient. And I think that's what really makes our center at St. David's stand out.
And Kathy, you were telling me that some of your symptoms, besides fatigue, like walking, was really a challenge.
Walking was a challenge. I was having a hard time getting from my house to my car without taking a break. And the day before I was diagnosed, I remember having to walk across a really long area of grass, holding my set bag and a chair. And I stopped 3 times and was hoping that the people I was with didn't notice because I thought I was out of shape. I thought I was out of shape, but really my heart just couldn't keep up. So then the next day I'm in the hospital being treated. That was totally unexpected. And I'm so grateful that it turned around and that I'm sitting here today.
How long were you dealing with those symptoms?
Aggressively a month. For a month, it was really hard for me to breathe. And when I would sleep, I could hear myself panting and I was sweating a lot. So that was going on for a good month. But it was several weeks before that I was not feeling well. And if you Google all of those symptoms, you simply think that you have long COVID. You think that you might have the flu. I even thought at one part it was Epstein-Barr. So it's very easy to disguise what you have with something else, especially if you're not getting professional attention, if you're not getting advice from professionals. It's very easy to look things up and make your own conclusions. So I urge people not to do that, especially when there's a place like St. David's where they're going to treat you and they're going to take the best care of you that they can.
This was still during COVID times, right? I think like towards the end, right? In 2022.
Yeah, post-COVID, but still, we were still wearing masks. So it was very easy to assume that that's all it was.
And doctor, you said it was very easy now to diagnose this type of cancer. Is that right?
Yeah, leukemia is in the blood, so all you need is a simple blood test and you can find it. And it is very, during the pandemic, a lot of people came in with very similar symptoms, and a lot of folks thought it was related to a virus or long COVID. So it's very common to hear that.
And talk about the treatment here that saved Kathy's life.
Well, what we had to start off with was to get her into a remission. So we had to give her 4 rounds of chemotherapy. So this is, time in the hospital. The first round was about 3 to 4 weeks in the hospital. And then she was released, and then she'd come back for a couple of days, and then we'd kind of keep repeating those cycles to keep her in remission. We learned early on by studying her leukemia that her leukemia was probably not going to go away with just the chemotherapy we were giving, and that she needed a bone marrow transplant to protect her from this leukemia coming back. So at the same time, when we started the treatment, we started looking for donors. And as soon as the donor was available, we moved on to the second phase of the therapy, which was getting her through the transplant and then dealing with the complications afterwards.
Kathy, what went through your mind when they told you, all right, here's the next step. We have to wait for a donor. What went through your mind?
I honestly felt very comfortable at St. David's. I knew that I was surrounded by incredible professionals, so I really let myself over to them and did not allow myself to think that they weren't able to handle what was ahead of them with me. So even though I was terrified and very sad and very sick and weak and I wanted to go home, I realized I had to get through this and that someday I would get over it. And so I definitely kept that frame of mind the entire time. But also I want to say that St. David's was incredible. They really do have a team. I did feel like I was in a family, and it didn't matter who I was talking to that day. They knew what was going on with my treatment. They knew how far along I was within my treatment. So it didn't matter what was happening. There was somebody there to care for me.
Something I didn't know was that this treatment here at St. David's South Austin Medical Center is the only place here in the Austin area that offers it. I had no idea.
That's right. This type of treatment is only available at specialized centers. And a little over a decade ago, we, decided that Austin definitely needed one of these centers, given how big the city was. And people had to leave town to get these type of treatments before. And now they have the availability of these treatments here in town.
And Kathy, you said we were talking earlier, and you told me that they didn't sugarcoat things for you, and that actually kind of helped you through this process.
Their level of professionalism was out of this world. Nobody sugarcoated any of it. And when I needed questions answered, they were very willing to answer those questions honestly. So going into it, I feel like I was pretty prepared for what was about to happen. And everything that they said was going to happen happened, with some additional things that were not foreseen. But they knew how to treat all of it. They had answers always. And if they didn't, the doctor would come in or one of his associates would come in and were able to take care of whatever it was I needed. I feel very fortunate to have had the level of care that I had in a hospital that was quaint and felt very positive, very welcoming, very safe.
Did you develop any relationships you still carry on today?
Yeah, interestingly, yes. The nurses, some of them have become clients of mine. And then when I come to the clinic, they come to talk to me, including Rama, sometimes Dr. Rama Krishnan, sometimes when I can get a moment with him. So it's still a family setting. I still feel like I'm part of a family when I go in there. And I'm actually sad that I won't be going into the clinic anymore, but grateful that I don't have cancer anymore.
And how early was this cancer detected? Was it like in early, or was it like closer to maybe a later stage?
Well, this was probably going on for a little while, but it was pretty advanced when she came in because the white blood cell count was so high. 300,000 is very, very high. Normally, your white blood cell count is around 4 to 10,000. So 300,000 is way higher. And as those blood cells keep going higher and higher, they can start clogging up the blood vessels. And people can have a lot of difficulty with breathing. And oftentimes they pass out, and oftentimes they don't even make it to the hospital. They have bleeding complications. So lots of things can go wrong. So we were very fortunate that we got Kathy in very quickly. As soon as we heard the number, we were like, oh, we need to go right away. And we were able to get her in and start treatment right away.
Doctor, let's say if, can I just go and ask my doctor, I don't have any symptoms, but maybe I just want to rule this out if there's history in my family? Can I do that?
So it's a good question. I think it's a personal one. I think everyone should speak to their doctor about their concerns. And again, all it takes to look at your, for something like this is a simple blood count. And that's often done as part of a routine health physical. Not all the time. For a young person who's otherwise healthy, they may not need it. But it is something I would encourage everybody to talk to their primary care physician.
And Kathy, I've noticed as you hear back some of the comments from Dr. Ramakrishnan, what are you reliving those moments?
Yes, and I'm regretful that I did not go sooner, knowing I wasn't feeling well. But I'm sorry, what was the question again?
Oh, are you reliving those moments as you hear?
Yeah, I remember that day really vividly. And I also remember the multiple conversations I was having with several people in my life about how I wasn't feeling well. And I was at the time working on a television show here called Walker, and we were about to wrap the show. So I was going to wait another 6 weeks when we finished the show to go to the doctor, in which case I would not be sitting here. So I'm really grateful that people were pushing me to go. And I feel like it happened right in the nick of time, and they were so proactive and so smart that they were able to diagnose me within a few days. And I started treatment within probably 48 hours of being diagnosed. I was on chemo already. So I'm just so grateful that they were so intelligent and so professional. And he's such a master at his work that he was able to get me out of that very sticky, very scary, very unfortunate situation.
So you were in the middle of a work project, and you were also dealing with these symptoms. Like, what was the turning point that said, okay, I do need to go get checked?
Other doctor clients. I probably, like I said, I don't think I would have gone, but it was other clients that I have that are physicians and work in the medical profession that were like pushing me to do it. So the advice that I would give anybody is listen to your body, but also if the smartest people that you know are telling you to go get it checked out, then go get it checked out. Don't wait until you're almost unable to breathe.
There's another layer to the story. You're going to eventually meet the person that helped save your life.
Yes, my bone marrow donor is this beautiful young man who lives in Germany, and he was gracious enough to travel to give me his bone marrow. And I don't think it was very easy. I think it was difficult. I think he felt pretty bad after it happened, but he didn't know anything about me, and he was generous to do something like that for me. So through time, we've been able to connect with one another. And so I look forward to meeting him in the near future.
What have been those conversations like? When that initial call when you talked for the first time?
I cried like a baby and then laughed because he was just the brightest light you could possibly imagine. And we went through his process, and he was telling me about his life, and we both learned that he's an actor, and I work with actors all the time. So we felt very connected that way. But, he's a very selfless person. And I think that had the stars not aligned the way that they did, and now I operate 100% off of his transplant, 100% of my chimerisms.
Chimerism.
Chimerisms are from him. So he's my blood brother forever, and he will forever be in my heart. We will hopefully keep a close relationship for the rest of our lives. Very grateful, very grateful.
Doctor, we were before we started before we started this web stream, you were speaking about that there are some donors that even if you don't match, that could possibly help somebody in the future.
That's right. We'd encourage everyone, especially young individuals, to get registered on the National Marrow Donor Program. It's very easy. All it requires is a cheek swab. And we've developed some changes in our techniques, which allows us to use donors that aren't fully matched. There are a lot of folks from certain ethnic backgrounds that don't have a lot of fully matched donors in the registry. If you're of Northern European descent, typically there's about an 80% chance that there is a donor who's fully matched. But if you're like me and you're Indian background, that's not the case. If you're African American or Hispanic, again, very low rates. So for those folks, we are now able to get more donors because we don't have to match as closely. And the transplant success rates are close to those that are fully matched, so almost equivalent. So it makes a big difference. There's almost a donor for every patient.
Wow, that's great to hear, and hopefully that gives people hope out there who may be dealing with something like this or know somebody. If you can again, if you can elaborate on the research that is going on here in Austin.
Yeah, we are part of the Sarah Cannon Research Institute, and through Sarah Cannon, we offer clinical trials. A lot of these are focused in the blood cancer space and involve using cells to cure people of cancer. We're also testing new small molecule drugs to specifically target mutations in blood disorders, and also different ways of using the immune system to target blood cancers. We're also experimenting with different ways of manipulating transplants to decrease recurrence rates if we can program cells in a way to attack leukemia cells and put them back into patients. So these are some of the clinical trials that we are involved in. We're very active in this space, and it's really an important component, and I think very, very standard for any transplant center. We need to do research because we're always trying to get better. We haven't perfected our techniques, and we need to offer patients hope and novel treatments when they're in difficult situations.
Kathy, something I forgot to ask you is what was the recovery process for you?
Recovery was rough. I was very ill, very weak, a lot of vomiting, which they prepared me for, a lot of medication, a lot of time alone, a lot of solitude. You're very vulnerable. You don't have any white blood cell count. You don't have any white blood cells to fight off infection, so you have to keep yourself very small. It was a very lonely time. I look back on it and I can't believe I got through it, but I slept a lot. I tried to eat. I kept myself very hydrated, read. It's very much mind over matter, very much positive thinking. And I had the best support from not only the medical staff at St. David's, but friends and family who were really there for me. And that's what keeps a patient going is the love and support, and also work friends, the film community. People really kept me lifted up. But also just seeing Rama and hearing good news every day and hearing that I was getting better and better. Ramakrishnan, I'm sorry. Hearing Dr. Ramakrishnan come in and tell me that I was getting better and better, that really, I knew he was being genuine and honest and professional, and that kept me going. That I was being treated beautifully at such a beautiful facility with amazing people.
Situations like this, it's also important that the community keeps your heart beating. So that's also important to have that support system, like you said.
Yes, and at the end of the day, it was just the medical staff. You can't see too many people, and you're still going to the clinic, even when you're not in the hospital, you're still going to the clinic. And so the nurses, the most incredible people I've ever known.
As we wrap this up, any final thoughts, a message you want to share to someone, or maybe something I didn't ask that you want to share with people that are watching this? For the questions for both of you.
Go ahead, Doctor.
Well, I just want to share a little bit about my team and that we come to work every day. We really want to take care of everybody like our family, and I think we've built a special culture here at our facility. And I'm really proud of them and how hard they work. And it's gratifying to hear some of the positive things that Kathy's saying, because obviously she had a very good experience, and we want to make sure that it could be one of us, right, in that situation. We want to be able to have these treatments available for us here locally, and to be the best at what we do.
Kathy, any final thoughts or something I didn't ask you want to get across?
I want to say that you don't have to leave the city of Austin to get critical, incredible care. We have these facilities, we have these physicians, we have physicians with their amazing teams, especially Dr. Ramakrishnan and his team that can treat you for these things. So I think it's amazing for the city of Austin to have something like St. David's here and such a special program to help people get through things like this. So take care of yourselves. If things aren't right and you don't feel well, act on it immediately and just take their advice. If they tell you not to do it, don't do it. If they tell you you're going to get through it, believe that, because all of that is very true, especially in my case.
Wow, very beautiful. Thank you so much to the both of you. And Esme pulled up this web story that we have online for you. We also have a slideshow of pictures that Kathy shared with us, and along with links to symptoms that you need to watch out for. We have a link to the hospital where you can get more information. Again, thank you so much for sharing such a resilient story and a story of love. I can feel the love there between you two and the medical staff that we haven't even met yet. Thank you.
Yeah, thank you both for joining us and for sharing your story, both sides of the story. It's very great to hear people talk about this, real stories that are happening around us in our community all the time. So thank you so much for sharing that. Jose, thanks for bringing this story here to Simple Health. Again, I want to remind everyone, whether you're watching on social media, our website, or our mobile app, we are also available streaming on any streaming TV app that you have. Completely free. Go to your app store and find KXAN Plus, and please download that app so you can watch our show again that we just did, or much more shows just like this one. Thank you all. Thanks for joining us.